Hi, everyone. Thank you so much for joining. We're giving folks a minute to get into the room, but it is 9 a.m. here in Washington, D.C., about 5 p.m., I believe, in Nairobi and Kampala. So we will stick to our time and get started shortly. But welcome in, and thank you so much for being here. Just a couple housekeeping notes from me. You'll notice as participants, attendees, your microphones and cameras are disabled for the webinar. However, we have a Q&A function right at the top of your screens you should see. And so that is the box where you can use to interact with our panelists, and we'll be having a Q&A session later in the webinar where we'll be combing through those questions and directing them to our panelists. So please feel free as the panel begins and we get into our conversation to drop your questions into that Q&A box. And we're so happy to have you here. I'm going to officially kick us off as people continue to get in the room, but I want to keep us to time. Good morning to those joining from the States. Good evening to those joining from East Africa or other regions in the world. We're so happy to have you here today for our webinar, Addressing the Needs of Unaccompanied and Separated Children in Displacement Settings, Insights from East Africa. My name is Victoria Walker, and I am a policy analyst at the U.S. Committee for Refugees and Immigrants, USCRI. And if you were not sure who USCRI is, we were established in 1911, and we are a non-governmental, not-for-profit international organization dedicated to addressing the needs and rights of refugees and immigrants. And working with our affiliates, USCRI, we provide legal services, social and health services to refugees, unaccompanied children, trafficking survivors, and other immigrants in the United States, as well as in El Salvador, Honduras, Mexico, and most recently Kenya. We are also an organization rooted in policy and advocacy, and we advocate for the rights of refugees and immigrants both nationally and globally, helping to drive policies, practices, and law. So as we join the global community in preparing to mark World Children's Day tomorrow, we are reminded that children are indeed our future, and there are no sustainable solutions without them. Yet around the world, children are coming under attack and they are forced from their homes as conflicts erupt, climate shocks destroy communities, and instability undermines their futures. In the East Africa region and surrounding subregions, millions of children are displaced, and the region is grappling with the largest child displacement crisis in the world, which is happening in Sudan. Among the most vulnerable are those displaced without their parents or caregivers. Unaccompanied and separated children face heightened risks of violence, exploitation, and neglect, with significant barriers to accessing essential services and protection mechanisms. So today I am honored to be joined by child protection actors from both Kenya and Uganda to discuss the challenges and best practices for supporting unaccompanied and separated children in displacement settings. We have various voices on this panel, representatives from international NGOs, a refugee-led organization, as well as UNHCR, all striving to protect displaced children. So today we will hear from, and I believe they are all on your screens right now, we will hear from Mr. Moses Otai, Country Director at Child Fund Uganda. We will hear from Ms. Florence Mukandukutsi, Programs Manager at Hodari Foundation. We will hear from Lena Koki, Senior Protection Community-Based Associate, focusing on child protection at UNHCR Sub-Office in Dadaab Refugee Camp. And we will hear from Mr. Burhan Abdiker, Program Coordinator at USCRI Kenya. So we're excited to hear from all of you today, and thank you so much for joining us. I will first turn to Mr. Moses Otai and ask, as an organization working to support vulnerable children in Uganda since 1980, how does Child Fund Uganda work to protect and support unaccompanied and separated children in displacement settings in Uganda?
Thank you, Victoria, for that question, and thanks to everybody who has joined this webinar. As already been introduced, my name is Moses Otai, Country Director for the Uganda program, Child Fund International. Child Fund has worked in Uganda since 1980, addressing both the needs of children in distress, especially around displacement, as well as children in other forms of need that need our assistance. But for today, I will restrict myself just to speak about how Child Fund is working to address the needs of children who are in displaced settings. Now, we all know that Uganda is a country that has a very progressive refugee law and policy. And as a result of that, Uganda is hosting right now 1.7 million refugees. And over half of those are actually children. And around actually about 50,000 of those are those who are unaccompanied and separated. Now, Child Fund as an agency looking at the challenge of the protracted displacements within the region, decided to focus on building of community child protection systems within the refugee settings. And right now, Child Fund works in Palorinya refugee setting in the West Nile of the country, which hosts about 150,000 refugees. So there we are focused on building the community-based child protection mechanisms and systems that enable us for the delivery of services to both children who are unaccompanied and separated, but also to other refugee children, including children from the host communities. So these mechanisms include actually identifying actors that can be trained on aspects of case management, actors that can be trained on aspects of psychosocial support and counseling to the children and the families, but also supporting and strengthening the referral system and related mechanisms that should be able to deliver assistance and care to the children who are separated and unaccompanied. Also, as an institution, we have focused on ensuring that we build child-friendly spaces within the refugee settlement, whereby these spaces are places where children, together with the caregivers, come in and are supported in different ways possible for the children to cope, but also to be counseled and provided all the necessary assistance that they need. We work still within this system also to ensure that tracing and support with referral to the children who need referral supported. Then also still continuing to build a system of the leadership, especially the refugee welfare committees, to understand their roles and responsibilities, but also most importantly, on how to support children who are in distress and in need of care, given the triple jeopardy that they face, that first and foremost, they get to be, you know, separated, but worst of all, continue in that situation of unaccompanyment. Also, still within the aspect relating to our work, we have also focused on ensuring that the learning of these children is continuous. So we look at how we support the children with ensuring that they are able to learn both at home and at school, and particularly also for the children who are below 5. We look at, for instance, how do we make sure that the parents continue with nurturing best parental care, especially the foster parents, including also other parents, to ensure that the child's learning stimulation continues. We have transitioned to make sure that these children are able to receive education And receiving education means that they receive individualized support in terms of what is needed for their learning, in addition also to what is needed for their well-being in the households, especially the foster families that support them. So that means also providing the foster families with livelihoods support and other economic strengthening related initiatives for the families that take on these children who are unaccompanied as well as separated. Thank you.
Thank you so much, Moses. I think that what you described really shows the need for holistic support and the various paths that need to be addressed to properly support unaccompanied and separated children. I was wondering if you could, you've touched on this a bit, but could you briefly describe for us what Child Fund has identified as some of the most pressing needs and protection challenges for unaccompanied children in Uganda?
Thank you. Yeah, if protection challenges that these children face, if I begin with particularly the older adolescents, one of while the younger children, you can easily be able to, connect them to a foster household and all that. But older adolescents find challenges of being connected to foster households. So already there is that challenge of, getting foster households for older adolescents. Then there's a whole challenge that follows that, and that's a challenge around their mental health well-being, because then, you lack emotional and social support, and nobody is willing to take on you and all that kind of stuff. So there is that challenge for those children. But then also there is a challenge relating to uh, basically ensuring that all that they need as children in a nurturing family environment is not there, because also the foster family that receives them already has children. So there is sort of an added, layer of vulnerability, even for the child still as a child is being taken on as into foster care. So that follows that child that level. But also what has been seen is really around how they cope. So you'll find again with adolescents, it goes back to exposure to child labor, because, they have to contribute to household labor, but also, try to look out for basics. So that has been observed for these children. It's also getting observed for the girls, the negative coping mechanisms, and being exploited, exposed to exploitation in various forms, including sexually. And one of the researches that we did, actually, we did see that there was a very big, in that settlement, there was a very big issue around adolescent pregnancies. And many of the reasons were given around coping mechanisms, and particularly also for the unaccompanied girls. So mostly the adolescents face the brunt. One, in terms of the negative coping mechanisms. Two, in terms of getting a home, to be nurtured in. But also children, the younger children still are faced with issues around being able to access meals, enough meals. Right now, there's a whole big challenge around rationalization of meals. So there is a reduction of meals. So still, there is a challenge around getting full meals. They have meals. Meals are being provided at a basic level. I would say. It's not at level that you expect, but they have the meals, but it's at a basic level that they have.
Thank you so Thank you so much, Moses. And I think you touched on some really excellent points about intersecting vulnerabilities, which we're going to speak with more and with Florence actually. And I'll turn to Florence now. And Florence, could you tell us about some of the child protection strategies that Hodari Foundation uses, especially as a refugee-led organization, in its programming to support unaccompanied and separated children in Chakatu?
Thank you so much, Victoria. Hodari Foundation is one of the organizations based in Chakatu, founded in 2020. And the main focus is on child protection and especially the unaccompanied children, children living with disabilities, and all children going through child protection issues. So as Hodari Foundation, the very first strategy that we've come up with and we are currently using to assess or have these children protected is having a child-friendly space. So we've come up with a space where our children, we meet with them on a weekly basis, and we are able to interact with them, find out the pressing issues they have been going through or they are going through, and be able to find a way to resolve or find a way to work with other partners that are really engaging in child protection. So the other way we've engaged them in participation, where we believe the solution comes from within us. So it is within us, these children really knows what they are going through. So we are running away from the mechanism or the strategy where we think for them, but as they come to our spaces, we involve them, get to know what they are going through, and they're able to suggest the solutions, and we are able to build on their solutions to come up with a very persistent solution. So the other strategy is advocating. We have an advocating team where we advocate for their rights in terms of education and in terms of sourcing for scholarships, sourcing for clothing, sourcing for food and shelter. This, as we know, these unaccompanied children, most of them find an issue with food, like the brother said earlier, but also education becomes a challenge in Chakatu, since not like everyone is able to attain a scholarship from the education implementing partner. So in this way, as we are advocating for their rights, we are able at least to solve some of the challenges that they are going through. So the other strategy we've implemented is strengthening the referral pathway. So we know really that we may not be able to solve all the challenges that our children are facing. So here we are able to map the organization, the NGOs that really work with children and can provide the certain support like counseling that we are not doing, like SGBV, where we have the focal person as a light, and we're able to know that in case this child is facing this problem, where are we to refer this child? So having put the referral pathway strengthened, we are able to assist our children in real time. But also we've been able to coordinate with the local leaders, the CPCs, the village health teams. These are the pioneers in the communities. We might not be on the ground every time, but these are people, they are the eyes in the community. So working together with them has really enabled us to really make follow-ups on our children and how they're doing to be able to support them. Then the last strategy, but not least, we do make follow-ups. So we make follow-ups in case we've referred a child to an NGO or a partner that is handling, let's say, children living with disability, providing maybe walking sticks. We do follow up and find out if this child has been assisted or needs more assistance. So that's what we've done in Chaka and is really helping. Thank you.
Thank you so much, Florence. And I think it's pertinent to underscore what you said about empowerment and solutions from within. And I think that's definitely a key message we want to get across today on World Children's Day and every day, is that children are championing their own solutions. They are engaged, they are involved, they know what they need. And so to have strategies that allow them to express their own needs and process what they have been through with assistance, but allowing them to have that empowerment is really important. And I know you touched on this, Florence, and just wanted to ask if you could expand a little bit into Hodari Foundation is working with children with multiple vulnerabilities. So you mentioned children with disabilities, for example. So how do you continue to support unaccompanied and separated children who may have disabilities, or the girl child, for example, who we know face heightened threats of sexual and gender-based violence? What are those needs like?
Thank you so much. Some of the children, which is a big percentage at our center that we work with, that are taken to be with a disability, these are children living with albinism. These children, most of the times, are criticized, not really engaged, not taken as really human beings. But at our center, what we've done is that we've made sure of inclusivity. As we are working with children, the key message to them is that everyone is very important and is as same as the other one. So having training our children to grow up with that mind has helped these other children with multiple vulnerabilities to be able to fit in the society where we operate. But also, our team has also been attending disability mainstreaming trainings where we are taught, where we advocate, where we speak out on behalf of these children with multiple challenges. But also, we've been able to advocate and source for some items that would help these children. For example, children who cannot clearly walk, who have issues with walking, issues with sight, the people living with albinism, we're able to source for some items that can help them to cope with these challenges at the center. With the SGBV and our unaccompanied children, the girls, we've introduced the referral pathway is the main thing, because we have partners engaging into GBV, where a light is the focal person for GBV. So we make sure we refer and continuously make follow-up with the partner to make sure this child is supported.
Thank you so much, Florence.
Again,
Go
but again with the children with disability, at our center we've introduced friendly games where they can feel free to also have the games, and when they are also involved in those friendly games, they feel at home and they don't feel any difference from their families. Thank you so much.
Thank you so much, Florence. I think you spoke so beautifully to breaking down stigma and notions that exist, and when we see differences, and even working with children and what that means to bring down those barriers and know that we are all the same. Thank you so much. I want to encourage everyone, because we are putting a lot of information out there, and I'm sure there will be questions, and we will have a question and answer portion. So to save time, I just want to encourage you to use that Q&A function. Our audience, you can start dropping in your questions now, and we will address them. But I'm going to pivot us over from Uganda over into Kenya, and hear from Koki with UNHCR Suboffice Dadaab. And Koki, could you tell us how the child protection team in Dadaab is identifying and supporting unaccompanied and separated children who arrive at the camp? And how many unaccompanied and separated children are typically in Dadaab, and for what reasons are they arriving unaccompanied?
Thank you, Victoria. And quickly, just to give you an overview of Dadaab, we started, the camp started in 1991, and with 90,000 refugees to provide them with protection and assistance. But now we are at over 400,000, and 58% are children below the age of 18. So currently we are at 2,146 separated and unaccompanied minors that are children that have come in. And we are seeing the rise between last year and this year because we are finding more children are coming in separated with relatives to come and access services like education, healthcare, and protection in the camp. How we identify, we have help desks uh, stationed in each block, but we have in one camp, we have 139 blocks, but we have only 55 child protection blocks. So which means then we don't have enough child protection help desks in the blocks, but then we have child protection volunteers and we have child protection committees. Then they would go out and once they realize that they have children that have come in every day, then they would send the children to us and the information to us. Each child protection help desk has a code tool, so they register every name and every child that is coming in. We also have best interest assessments and best interest determination that UNHCR uses to be able to support children and separated and unaccompanied children to get durable solutions. We also have the referral pathway that also works very well for us. And we also have partners and even the police referring these children to our partners, child protection partners, and also UNHCR. We also have walk-ins that come in that would come and let us know that we've just arrived yesterday or 2 days ago or a week ago, and we need this service. We also have community-based structures, also the leaders, the GBV committees that we have, and also the health committees that we have that would refer these cases to us. So once these cases come to us, then we provide the services that they would need immediately. We provide also cash-based interventions to support their basic needs. We also offer emergency social support and dignity kits for whoever needs to be supported. And we also register them with in CPMS Plus and Progress databases that are used by partners and also UNHCR. As I said earlier, most of the children are coming in here to get access to services, and some of them would come as unaccompanied, but they came in with adults who are sometimes not known to them and others known to them. So once they come in here, we register them appropriately and then provide them with support immediately, because we already have foster families that are already in our systems and ready to receive because they've been trained and also been provided with certification. So they are able to assist the child immediately. So once we place the child there, we don't leave the child alone with a foster family. We continue monitoring these children and ensure that they are in the best care. Over to you.
Thank you so much, Koki. And I just want to highlight a couple of things that I want people to understand and the population size that we're talking about. And even in just Dadaab, what Koki was saying of over 400,000 refugees and asylum seekers right now, and well over half of that population are children. And I think as we're talking about resources and advocacy for designating resources and child protection capacity, that is certainly something to keep in mind. And Koki, I wanted to ask you, you spoke about the foster system and as well as different pathways for unaccompanied and separated children in Dadaab. Has the team been successful in facilitating family reunifications at all? And what are some strategies for reintegration of unaccompanied and separated children into communities in Dadaab? Oh, I think you're just on mute.
Okay, we are not working alone. We are working with the government as well. So we have the sub-county children's officer who is working with us to be able to identify and also provide solutions. So, and just to say that our best interest is that we also have the court here with us now. So some of the solutions are found just locally here. So, and we also have Kenya Red Cross Society that helps us with tracing and family reunification of these children. And as I alluded earlier, we also have the best interest procedure that we use also to identify these children link them to their parents or to their relatives. We also are working with the Directorate of Children's Services, not only in Dadaab, but also in Kakuma and in Nairobi. So once a child comes here, then we try and reach out to our offices in the other areas just to find out if they have relatives there. So those are some of the interventions we use, and including the community as well.
Thank you so much, Koki. That's so helpful. And I think it is a perfect segue over to Berhan and what you spoke about connecting various stakeholders and that no one is working alone in this and why it's necessary for us to collaborate and that there are frameworks there as well, including with the government to protect these children. And so, Berhan, can you speak to some of the legal and policy frameworks in Kenya or the broader region that protect unaccompanied and separated children?
Yeah, thank you so much, Victoria, and also the attendees, as well as the panelists for giving an important discussion on this. And in the region, child protection laws and frameworks are very strong, but it often requires, enhanced collaboration between the national, the regional, and also the international entities to address, the needs of the unaccompanied as well as the separated children when it comes to displacement setting. So in Kenya, we have the Children Act of 2022, which I believe is a foundational piece of legislation that ensures the rights and welfare of all children, including the unaccompanied minors that we're discussing today. And the Act provides, specific protection for children who are separated from their families, highlighting the rights of the family reunification, access to education, and protection from abuse as well as exploitation. So it also establishes, specialized services such as child rescue centers, and it emphasizes that child welfare should be, a priority for local governments as well as, the NGOs. And the Act mandates that, the best interest of the child should always, be considered in any decisions regarding their care. And if we go regionally, the continental level, we have the African Union, which stands, at the forefront of protecting, children's rights across the continent through its cornerstone policy, the African Charter on the Rights and Welfare of the Child. And this charter creates, a unified framework for child protection with member states, pledging to uphold, comprehensive safeguards for all children, and particularly those who are most vulnerable, the refugees, the displaced person, and also the unaccompanied minors. And this African Union Charter also is a provision that represents, a collective commitment to, ensuring that these children's welfare remains paramount, throughout their displacement journey. And it's integral to the African Union's approach. It's the refugee protocols, which I'll say it establishes a detailed guidelines for the care and protection of displaced children. And these protocols mandate that member states provide support services. It emphasizes the critical importance of family reunification and prohibiting mistreatment as well as inhuman treatment of children, especially the ones in detention facilities. And by setting these standards, the African Union creates what I will say, a protective environment where displaced children's rights are safeguarded and protected, and their fundamental needs are also met, all while actively working towards reuniting the separated families and restoring the family bonds and links. And another regional body we have in East Africa that also protect the children is the Intergovernmental Authority on Development, IGAD, which I will say plays a crucial role, especially in East Africa, and especially when it comes to in conflict and displacement zone. IGAD has developed frameworks and mechanisms that focus on the welfare of displaced children, ensuring that they are protected from things like trafficking and other forms of exploitation. And these efforts are particularly important, especially in the Horn of Africa, where children often face vulnerability due to the conflict in those areas, and also in Sudan. What's happening currently in Sudan, I think IGAD policies really come in hand. And it also has what we call the conflict early warning and response mechanism, which helps, the emergencies that, put children at risk, while also, regional cooperation strengthen child protection system across the member states of the IGAD. Despite all these frameworks, I believe challenges still exist. There are a lot of gaps, especially when it comes to things like, resources, things like coordination and capacity, especially in conflict, prone areas where displacement is frequent. So regional organizations like also the East African Community Child Policy works towards integrated child protection systems. But when it comes to national government, we often struggle to I'll say effectively implement these systems in crisis context. So this highlights the need for I'll say for a stronger collaboration across borders to ensure that our children, especially particularly the unaccompanied minors, always receive the care and protection that they need. So while there are several strong legal frameworks in place, both nationally here in Kenya and also regionally at the continental level, the effective protection of the unaccompanied and separated children when it comes to displacement situations requires I'll say improved coordinations. It requires a lot of resources, and the most important one, it also requires a political will, and these are the key to the key success in fostering cooperation between our governments, between the regional organizations, between the international agencies, just to ensure that the rights and the welfare of these vulnerable children are prioritized. Thank you,
Thank you so
Victoria.
much, Farhan. Thank you. I think, touching on political will, as well as collaboration and capacity are so important when we're talking about implementing legal frameworks that may exist and that do exist. But we need that capacity and will to make tangible impact. And so I want to make sure we save time to address the questions that are already coming into the Q&A. But Burhan, maybe you can give us just one example of how USCRI Kenya is in collaborating and engaging with stakeholders, be it in Kenya or in the broader region, to protect displaced children.
Yeah, thank you. I think at USCRI, since we opened our office here in early this year, we are deeply committed to ensuring that the unaccompanied and the separated children receive the protection as well as the care that they need. And to achieve this, we work closely with various partners, leveraging the multi, stakeholder engagement just to enhance, child protection efforts. And we have signed a memorandum of understandings, MOUs, with key organizations such as Child Fund here in Kenya, as well as Windle International. And we are also in process of, collaborating closely with the UNHCR team. And so this, partnership enables us, to collaborate effectively, combining our resources and expertise to address, the challenges these vulnerable children are facing. And as of now, we are currently, conducting our needs assessment with the Child Fund here in Kenya, just to better understand the specific requirements of, the unaccompanied minors in refugee camps, as well as those ones in the urban settings. And this assessment hopefully will, guide our interventions and will ensure, they are targeted and impactful. And by working together, we strengthen the child protection system, and it ensures a comprehensive, a community-centered approach. Local communities, government agencies, the international organizations, all these, they play a critical role, in this effort. So through these partnerships and the ongoing collaboration, we are building a future where I'll say, every displaced child, is treated with dignity and provided with the care that they deserve.
Thank you so much, Burhan, and thank you to all of you, Moses, Florence, Koki, and Burhan, for your insights and expertise today. I'd like to open up our Q&A session and turn to some of the questions that have been already posed in the chat, and thank you all so much for putting those in there. I'm seeing a couple pop up about education, and I know this was something that multiple speakers addressed. And so to any of our panelists, Daniel asked a question about advocacy for scholarship to help with education, and he asked, what are the challenges for those that are still in centers, and I'm assuming that meaning camps and settlements, regarding continuing with education? And so maybe Koki or Moses, or Florence, if anyone who'd like to approach that question of what are some of the challenges for those children who are still in camps or settlements in continuing education.
For Dadaab, we have tertiary education, but it's not enough. So you find a lot of adolescents then would have finished their school, but then there's nothing else for them to do. So it's just a big gap for us out here, because if we are talking about DAFI scholarships and the WUSC scholarships, they're just limited to a few. But we have a lot of children, like I said, 58% of the population here are under 18. So the gap is large. What we can do because we have partners and we have limited funding where we can give them skills training, but it's not enough. So the gap still continues. And if there's any support, we would appreciate it.
Thank you so much, Koki. Did anyone want to add on to that? Moses?
Okay, thank you. Education, just like in Uganda here, you'll find that they can be able to access free government education, but then there are hidden costs associated with that, relating to scholastic materials and everything else that needs continuing support to them with that regard. But also, most importantly, that education is one aspect of building resilience. So you will find that it's critical to ensure that the children still continue with skilling, aspect. So if as much as possible, people can be able to invest in skilling, technical vocational education, for the adolescents, because as when the scholarships are few and even getting to university with still those scholarships few, but technical vocational education that ensures that someone has the right skills for their own, takeoff in life and for livelihood, I would strongly recommend and encourage that partners continue to invest in technical vocational education for the refugee children. Thank you.
Thank you so much, Moses and Koki, to both of you. And there's another question in the chat related to education, which I'm so glad to see because as we're marking the CRC's adoption, education is a right for all children. And so that's important to highlight today. And I'm thinking, Florence, can you speak to the question here asking how we can support youth and children in encouraging them to attend school? And are there resources you would recommend for continued education? How is Hodari Foundation approaching encouraging the children it serves to be in school and to have that?
At Hodari, what we do with the children, we have to encourage them to be in school. We continuously talk to them. I would say it's the very thing because it's also about the will, showing them the value of education, how important it is. Because you come to understand that when it comes to unaccompanied children, they have lost hope. They've like almost hated everything. And when you talk of education at times, they don't have the will to go to school. So the first step, we talk to them, encourage them, and show them the value of education. But also, I said earlier, so like Chaka, there are those partners like FCA, also UNHCR, Window International, handling education and offering scholarships. And the other part that we normally like talk to those people about the specific children in case there is anyone willing to go to school. However, like earlier said by my colleagues, Koki and Moses, it's always not enough. And when you look at the competition for the scholarship, you find only 2 people are picked per year. And it's so competitive to performance, where some of our unaccompanied children have no capacity due to the depression to get the grades that are required to get the scholarship. So to me, I would actually call upon the partners that in case there is an opportunity to really consider them in some special way, in specific conditions, that they can also be considered whenever scholarships are being given. We would really appreciate that. Thank you.
Thank you so much, Florence. I think that's something for this audience to hear, certainly, and really understand is that even the scholarships that are there, they are very few and far between when we're looking at the number of children that need access to education and want to. And then I think the other part of that being the mental health side that you address, Florence, and that unaccompanied and separated children have been through oftentimes unimaginable trauma. And so the need for mental health care and in terms of making them feel well and hopeful to be able to go to school and see their futures in that way. So thank you for bringing that today, Florence. I'm seeing a couple questions in the chat related to the journey of unaccompanied and separated children in the region. And what that looks like. So can any of the speakers expand upon the journey of unaccompanied children to Uganda or to Kenya? I think people are wanting to know from the care provider side, then how would that trust be built? I think there's a need to understand where children have come from and what they've experienced to be able to then support them and protect them to the best we can. So can anyone speak to the experiences of unaccompanied children on their journey in the region, as well as maybe the impacts once they're in the camps or settlements?
I'd like to say that there are various reasons why they cross over, and it could be trafficking, could be smuggling, could be exploitation, it could be poverty, it could be lack of access to education, as we alluded earlier, unemployment by the caregivers, so there's nothing at home, poverty, food insecurity, climate change, all this. and also social and cultural practices where some children are being forced to marry, and and also conflict as well. So as they come across, and especially I'm talking about Somalia, Ethiopia, they would come with relatives. Others would just come with unknown people because they're moving the same direction as they're moving. So they'll just cross over and come over. And once they come here, they come um, with no idea where they are, and some of them have never even gone to school. So then we start with some speakers have already talked about CFS, where we try to rehabilitate the children. So that they can start learning, start socializing, start making their small communities, because at the end of the day, we have to have a community-based child protection, because we don't have enough money to deal with this. We have to hand over this also to the government. We have to support the government to support these children. So the first instance will be psychosocial support, to be able also to clothe them, because some of them do not even have clothes, and that's a big gap that we have. They don't have clothes, they don't have shoes, they don't have anything to eat. So we have to also educate them, foster families, that these children are coming as they are, but we need you to support them. But we also try as much as we can to also support these foster families with some small stipend, so that they do not now, at the end of the day, bring more harm to the children. Any other speaker?
Yes. I would speak on behalf of Uganda, and particularly, let me draw it to Chaka, though it applies in Uganda. So when you look at Chaka, the biggest percentage of the refugees come from the DRC Congo, where we hear several words like almost every time. And these children cross with relatives, cross alone with anyone they actually don't know. And when they reach at the reception centers, it's a really a big challenge that sometimes the SGB partners are attached to them to foster families. Like they get people where they think they can fit. But at the same time, what we've realized as a very big challenge, having the foster families treat the children equally like their own children, or even feel like they are their responsibility to take care of these children, becomes a very big problem. So that's when you hear that when we have a one-to-one with the children, the big problem.
I think Florence, we lost you a little bit. We'll wait. Oh, Lawrence, I think we lost your connection just a bit. So, but thank you so much. I think, and we can come back once the connection is there. But I think both Koki and Florence spoke to the various challenges that exist in both the journey and then at arrival in settlements and in camps, and even just the basic needs of clothes, food, even for new arrivals when unaccompanied and separated children are getting there. So it's a incredible spectrum of need, both in the journey and on arrival. And Burhan, I think you had gone to say something as well.
Yeah, I just wanted to reiterate what Lina and Florence have said about the current migration patterns for these unaccompanied children, and mostly they are shaped, by a combination of regional conflicts, economic instability, and also the environmental challenges like climate change. So many children migrate within the continent. They moving from rural to urban areas or crossing borders, to at least seek safety, in the neighboring countries such as Kenya, Uganda, and also Ethiopia, which host large refugee populations. So some embark on these journeys towards, let's say, North Africa, with hopes of crossing the Mediterranean to Europe and other parts of the world. So socioeconomic factors, are driving this movement mostly, which includes, widespread poverty, lack of access to education and healthcare, and the collapse of the local economies in those countries due to conflicts or also climate-related events like droughts and floods. So I just wanted to add that. Thank you.
Thank you so much, Burhan, and thank you to all of you for your input on that. And to our audience, thank you so much for these questions. And we're seeing them continue to drop in. And I wanted to assure you that we'll be logging the questions and can connect with our speakers. If you have further questions, please do send them to me. I can put my email in the chat and we can have some follow-up there. But I think we've touched on a lot of things, the journey, arrival, trends, foster families, and there's so much still to discuss. But I wanted to take the last couple minutes we have to turn it back to each of our panelists and ask them in closing, what would you like our audience to remember as we mark World Children's Day tomorrow? If there's one thing from each of you that you would like our audience to remember, what would that be? And maybe we can start with Moses.
Thank you. The destiny of our children is in our hands. So it is our duty as actors of today to do whatever we can to make their tomorrow better. Thank you.
Thank you, Moses. Florence?
The last thing, or the thing I would like our audience to remember, is that our children have solutions. So let's engage them and let's allow them raise the solutions and we build on them. Thank you.
Absolutely. Thank you. And Lina Koki?
Yes, one thing I would want to say is we have children, we have 58% being children in the Dadaab. What can we do for them? They're coming here hungry, without clothes, without shoes. Can we support one child, just one child?
Thank you so much, Koki. That's powerful. Burhan?
Yes, on World Children's Day, I would like the audience to remember that every child, regardless of their circumstances, they deserve the right to safety, they deserve the right to education and protection. And this also includes the unaccompanied and separated children in displacement setting, who are among the most vulnerable. So their rights should not be overlooked, and their voices must be heard, in the global conversation about migration, child protection, etc., etc. Thank you.
Thank you. And I think these are the perfect words and messages for us to end on. And I'd like to give our heartfelt thanks to all of our panelists today for joining us. It is quite late in Kenya and Uganda, and we just so appreciate your expertise and your time. To the audience, thank you so much for joining us today. I'm wishing you all a very happy World Children's Day tomorrow. And may we, take these messages and these calls for action into tomorrow, but also every day. There will be a recording of this webinar that we will share on USCRI's website, and so we will be circulating that as soon as we have it. Thank you all so much, and be well and continue the work. Bye, everyone.
Bye-bye.
Thank you. Thank you. Bye.